So if a woman's progesterone is low, we think about looking at how can we increase egg quality. And some things that affect low progesterone is stress. Stress is a big part of the equation that can negatively affect progesterone. So low progesterone is something we always want to look at. And the way we measure progesterone is determining when a woman ovulates and then counting 7 days after ovulation and measuring the progesterone level at that time. We would ideally like the progesterone to be around 10, maybe 10 to 15 in that range for to show a nice progesterone curve with the woman's cycle. Progesterone is made by the corpus luteum, and our egg is released from the follicle, and then the remaining of the follicle forms the corpus luteum. That is the area that produces the progesterone, and we like to think of progesterone very closely connected with egg quality. So if a woman's progesterone is low, we think about looking at how can we increase egg quality. And some things that affect low progesterone is stress. Stress is a big part of the equation that can negatively affect progesterone. So we definitely want to look at stress resilience. Is there a way of incorporating, decreasing our body's reaction to stress in our life? So whether it be daily meditation, yoga, deep breathing, journaling, everyone's a little bit different about how their body reacts to different activities to help reduce stress. Progesterone's very important. I love the word progesterone, progestation. So super important for gestation, for keeping that fetus and baby alive and working well. About 6 to 8 weeks have passed in the pregnancy, then the placenta takes on the role of producing the progesterone. But before that, the corpus luteum, the place that is left once the egg is released from the ovary, that corpus luteum is what's producing the progesterone. And absolutely, it needs to be at a high enough level to support the baby, the fetus growing for those first 6 to 8 weeks until the placenta can take over. If it's not produced at a high enough level, yes, unfortunately, miscarriage, baby loss, pregnancy loss can happen. There has been studies done on progesterone, getting progesterone versus not getting progesterone, and honestly, the studies that are out there today seem a little inconclusive, or as far as it does not support giving progesterone to every woman once she's pregnant. So not to say that there isn't a place for progesterone. I think absolutely, especially if a patient has had pregnancy losses, it's very important to measure that progesterone level early on to see if it needs to be supplemented. And herb Vitex really helps increase progesterone levels in the luteal phase, and it's usually given in the luteal phase. And that also, Vitex helps to lower prolactin, which is another hormone. And if prolactin is too high, that is associated with infertility as well. So Vitex does a nice job at balancing both hormones.
If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.